Hello, Dr. Bharara. Welcome to our show. Thanks for taking the time for being on our show.
Absolutely. Drew, thanks so much for having me.
Yeah, no, it's a pleasure. So, why don't you start by telling our listeners a little bit about yourself?
Sure. I grew up in Birmingham, Alabama, big Alabama fan. And then decided I wanted to go to medical school after I had some orthopedic musculoskeletal issues. And went to medical school in University of Alabama in Birmingham, Alabama. I ended up training in physical medicine rehabilitation. So a lot of people don't know what that really is, and what that is a field in which we talk about functional restoration in the musculoskeletal and neurologic world. And I trained at Temple University in Philadelphia. Went ahead and specialized in pain medicine and in the spine. And I've been at the Virginia Spine Institute for 10 years now, doing a lot of both traditional pain medicine as well as really bringing on regenerative medicine to my practice.
Awesome. Yeah, so since you already dived a little bit into your practice area, can you tell us a little bit more about your practice? What type of patients do you see, and things like that?
Absolutely, absolutely. So as a practice, we take care of any type of orthopedic condition, any kind of musculoskeletal condition. Work with
Mhm.
surgeons and another non-operative doctors as well as a neurologist. So we really take care of everything. I am the director of regenerative medicine here at the Virginia Spine Institute. We on the non-operative side of things, we take care of all types of musculoskeletal issues, from your hips to your knees to your shoulders. I see a wide range of patients, from young kids, 10 to 12 years old, probably my youngest patients, all the way up to patients in their 90s, in taking care of all types of problems from fractures to tendon issues to a disc problem. I really kind of honed into a special field called regenerative medicine, in which we use the patient's own body to heal itself and to start that healing process. It's a little different than the traditional approach of pain medicine, in which we do steroid injections to try to calm the pain down, which I think has its role.
Right.
But with regenerative medicine, we kind of have a different idea of what we're trying to do. We're trying to get things to heal. So instead of just trying to get things to feel better, we're trying to get things to heal, to really kind of get that functional restoration. And I know we've shared several patients, and so you kind of have seen some of these patients that I've taken care of with regenerative medicine as well, I'm sure.
Yeah, yeah. No, I have had my share of patients shared with you who have gone through their journey of regenerative medicine, seeing the results from it, and then moved on to, physical therapy, getting back to activities and things like that. So, where does regenerative medicine kind of fit between the conservative treatment options and surgical? Because that's where the patients usually are, so where does it kind of fit in their realm of the options they have?
Well, I think regenerative medicine is becoming more and more popular because we have this gap. There's this gap between traditional conservative treatments that do get people better. I mean, we know that traditional non-surgical treatments, physical therapy, massage, other non-surgical treatments do make people better.
Right.
And then we had this gap. And so we have this gap in which we were saying, okay, you have a problem, but it's not getting better with traditional measures. But we're not ready for surgery. You're kind of or surgery is maybe too aggressive for you, or you can't tolerate surgery. And we have this gap where patients just can't get better. And so those are the patients that are unfortunately suffering. And so regenerative medicine kind of fills that gap, or tries to fill that gap, and
Mhm.
for patients that are trying to avoid surgery or can't have surgery at all, but has failed the traditional conservative treatments that usually get people better, but unfortunately are not in this situation. Or we use regenerative medicine to supplement, they're gotten somewhat better with traditional conservative management. And now we're trying to get them even better to a more truly functional restoration, get them back to the activities they want to do.
Right. So, it sounds like regenerative medicine kind of fits somewhere between conservative care and the surgery options. And usually, I know research takes time to back up when something is newer out there. So, how far along do you think there is research and data to support regenerative medicine?
Well, that's really interesting. And I think what we're seeing is that there is much more data that's coming out in support of the use of regenerative medicine. But I think it's really important to understand that regenerative medicine is the wild west. And so where you get your regenerative medicine and how it's performed is
Mhm.
just as important as what they're doing, right? So the idea of regenerative medicine doesn't all come the same. By doing it in one place, it's not going to get the same type of response as doing it in another place. And I think that's really important to understand. What we're seeing is we're seeing data for certain problems have better outcomes than other problems, right? We have level 1 data of using platelet-rich plasma in the knee to take care of knee pain. It's better than steroids. It's better than gel. We've seen it. And so we're seeing the data kind of come through. And I think we're going to continue to see that. We published a lot of data, actually. We published data on the use of regenerative medicine in the spine,
Mhm.
specifically injecting bone marrow or stem cells into the disc itself for something called discogenic pain, where it's back pain that's coming from a degenerative disc or a painful a disc. And so we've had a lot of success with that. And so we've published our data and we've presented the data, and that's extremely successful. We're going to continue to see that. And I think that's really important, because I know a lot of people have tried PRP or they've tried a procedure, but maybe they didn't get it from the right person. And with the way regenerative medicine is being performed now, unless it's performed by somebody who's really understands it, is able to talk to you about it, tell you why you're a good candidate or why you're a bad candidate for it, you probably won't have your most ideal outcome. So I think that's extremely important, but I think the data will continue to come.
Got it. So, in general, just to kind of simplify it for our listeners out there, who would you say, and I know it's, no one size fits all, is a good candidate for regenerative medicine versus your conservative care, like McKinsey therapy, physical therapy, and, other things we talked about?
Yeah. So I think it's really, I think conservative care with McKenzie therapy and physical therapy, even acupuncture, these are all things that need to be attempted before we could continue to even have a discussion regarding regenerative medicine. Because
Mhm.
as we know, most people can get better with the use of therapy. Therapy is first line, it's the best first, it's the least invasive and best first line treatment for most musculoskeletal orthopedic conditions.
Right.
If you don't get better using those conservative treatments, that's where regenerative medicine is an option. And so the ideal patient really, it's not about age. It's more about the specific condition that you're trying to treat, and
Mhm.
how how bad the condition is, what type of uh, um, comorbidities or other problems the patient has. So it's very particular about the patient. And that's, it kind of goes back to my point, is that
Mhm.
I think there are a lot of clinics out there that are just performing regenerative medicine on just anybody. And they're saying, oh yeah, we'll inject your knee joint. But they're not
Yeah.
really looking into and saying, who may be the best candidate for it? Oh, well, your knee maybe isn't the best candidate for it because you have severe osteoarthritis in multiple compartments of your knee, and you can barely walk at this point. Maybe we shouldn't be doing it. And so I really think we need to understand the pathology or kind of the severity of the injury to really understand
Yeah.
who is the best candidate for something like this.
Right. Yeah. And it makes sense for any type of treatment to work, having the best candidate is sort of a prerequisite for its success. So it makes sense. And lastly, would you have any general tips for our listeners to take better care of their spinal health? Since you work with so many, spine patients, I know you see all musculoskeletal, but specific to spinal health.
Well, I think it's really, I think something that, and I talk with a lot of my patients about, is that if something feels abnormal and something feels out of place, then
Mhm.
it's better to get it checked out early on than to wait. And I think the earlier we're able to address a problem, the more options you'll have. If that's from the therapy end of things, or if that's regenerative medicine, but even if we get to surgery, the earlier you're able to treat something, the better the outcome is. And I'm a big believer in early diagnosis, because if you can create the diagnosis early on, we can avoid all the other stuff that comes, the compensation aspect of things. If you hurt your knee, the person will also have a hip problem, or an ankle issue, or if they hurt their spine, they also have some hip issues. So I think it's extremely important that we're able to diagnose the problem early on, so that we have all the options laid out in front of them, from the conservative stuff to regenerative medicine, and any other non-surgical option would be available to a person that we're able to treat early. So if it doesn't feel right, it's better to go ahead and get it checked out.
Yeah, no, I love that. I love that you're saying it, because I completely agree with you, and I shared the same idea and tell it to my patients. So it's great to hear from a source like you to kind of reinforce the same idea. But yeah, thanks. Anything else you would like to add for us, Dr. Bharara, to kind of finish up this episode?
No, I think that's everything. I really appreciate you having me on and kind of discussing my practice and the use of regenerative medicine. I think it's something that is up and coming. It's getting more popular, but as things get more popular, it's getting a little overused and maybe used in situations where it shouldn't be used. And so I think it's really, really important that anybody who's even considering the use of regenerative medicine, seek the right person to really diagnose them and talk them through it, because that is the most important aspect of things, to get the best outcome and the optimal outcome.
Yeah, that makes sense. So where can our listeners reach out to you for a consultation, or if they have any specific questions or anything like that?
Yeah, so you can reach out to us at the Virginia Spine Institute. We're in Reston, Virginia. Phone number is 703-709-1114. Happy to talk to anybody about any of the problems that they have.
Awesome. All right. Thanks so much, Bharara.
Yeah, thank you so much for having me.